The Planned Parenthood Association of Ghana, members of the Council of the PPAG, management and staff of PPAG, distinguished partners and stakeholders, fellow CSOs in Ghana, members Association of International Planned Parenthood Federation, our abled youth representatives, friends of the media, ladies and gentlemen. I'm honored to be given this platform to share my thoughts on the theme, increasing numbers of sexual and gender-based violence in the case of COVID-19 or the revelation of truth. I am particularly excited because I have been selected by no mean organization than the PPAG to do this. And I remember that growing up, it was some of the advocacy work and some of the educative content from the PPAG that guided young people like us to make certain choices about our sexual and reproductive health growing up. So I thank God and the PPAG that I am together here. Let me say a big thank you to PPAG. And I pray you continue to do more for our young ones. Before we move on to the lecture, just 2 weeks ago, I encountered a story that broke me. That a teacher in a school was concerned about a student, an SHS2 student, who had been moved to an apartment in Accra. She lived outside Accra. He moved to Accra, where her school is, by her own father to serve as a sex slave. Let me call it as plainly as it is, for monetary gains for the family. And he was telling me that he went to the police station and the frustration was so much. But the question is, what do we do for girls like this who are in such situations? Not because they do not have a home or parents, but because these agents who are supposed to protect them fail to do so. We can only do more. Let's move on to the lecture. I'd like to define sexual and gender-based violence to start with. It refers to any act committed against a person's will and is based on gender norms and equal power relations as well. This includes physical, emotional, psychological, and sexual violence, as well as the denial of resources or access to services. Violence also includes threats of violence and coercion. Sexual and gender-based violence harms women, girls, and boys too, for those who do not know. And this constitutes a serious violation of their human rights. Gender-based violence is a form of violence targeting a person because of an individual's gender. It's a complex phenomenon that includes combination of sexual, physical, emotional abuse, even neglect or deprivation. The Committee on the Elimination of Discrimination Against Women has defined gender-based violence as a form of violence that disproportionately affects women. So some forms include sexual violence, violence against women, domestic violence, harmful traditional practices as well, such as female genital mutilation. Let's look at the figures. What are the statistics saying? Globally, according to the World Health Organization, 1 in 3 girls will experience violence in their lifetime, and many will experience it during adolescence. In the context of Ghana in particular, the 2016 National Survey reported how attitudes, beliefs, practices have led to violent actions against women being dismissed due to widespread beliefs that women give up their rights to their husbands at the point of marriage, particularly because of bride price. The patriarchal system of our Ghanaian society also, to some extent, excuses domestic violence, such that victims of intimate partner violence are less likely to see their situation as an emergency that needs to be reported. In Ghana, according to the Domestic Violence Secretariat's Here are the current statistics on SGBV in Ghana. So we're looking at defilement, rape, and assault. In 2014, for the cases of defilement, we're seeing over 1,200 cases. In 2017, it came down a little bit, 793. 2018, we're looking at over 600. And in 2019, 1,285 for defilement. Now for rape, in 2014, we're looking at a little over 300. And then 2017, still hovered around the 300 figure, but a little lower. 2018, 200, and 2019, 376. The assault cases statistics show that in 2014, we saw about 7,000 cases. In 2017, we saw about 5,019, 2018, 2,856, and then altogether in 2019, over 6,000. 1,200 for male victims and 330 for female victims. So in addition to the sexual violence and domestic abuse that is widespread in Ghana, other forms of violence against women in which society understands as outdated cultural practices such as widowhood rights, forced marriages, child betrothals, child marriage, female genital mutilation, and truancy, in which young virgin girls are placed under bondage in fetish shrines to atone for offenses committed by members of their family. The criminalization of older women, often widows, who become targets of witchcraft accusations, like what we saw in the case of ACCRA. Sad story. These have become a major form of violence in Ghana, and these women, they are often banished, often to secluded places where they can't have access to social amenities or are completely cut off. Further, although attitudes and practices change due to globalization and influences from formal education, the typical Ghanaian family is still a patriarchal institution. In the domestic sphere, men consider it a matrimonial right to control and discipline their wives, which leads to frequent intimate partner violence against women. But the big question is, what is the relationship between sexual and gender-based violence and COVID-19, and how the lockdown and the restrictions has brought about an increase in SGBV cases? The COVID-19 pandemic, like all other crises, will have a distinct impact on women and girls that is both immediate and poses the risk of exacerbating pre-existing gender and other intersecting inequalities. These inequalities remain the cause of many SGBV in our communities. In addition, the COVID-19 pandemic disrupted economic activities, particularly affecting self-employed workers who were forced to temporarily close down in some cases. And some of these are women who themselves are the breadwinners, who had to choose between their livelihoods and also attending to their family of children who would not be allowed to be in school and had to be at home. Many tough choices over the last few months for many, many women across the country. Also, the interruption in income sources has placed a financial and psychological burden on breadwinners in the cases where the men are the breadwinners, and can also result in increasing tension leading to violence. Few weeks into various lockdowns and restrictions seeking to manage the spread of the virus, there have been reported cases of SGBV. We heard about the statistics from March to May. The interim technical note by the UNFPA as of 27th April 2020 indicates the negative impact of COVID-19 on ending FGM, child marriage, and gender-based violence. They predicted an increase in the incidence of violence, and that prevention and protection efforts, social services, and care had reduced. and that included funding as well to such organizations. Now, COVID-19 is likely to increase the incidence of violence. Why? Stay-at-home orders and restriction increase women's exposure to partners who are violent or may now become violent because of their current situation. Economic stress resulting in household upkeep tensions could result in various abuses, while there were increasing calls to violence prevention hotlines and media reports of rising violence, abuse, etc. in other jurisdictions. We cannot measure the incidence by our hotline. From the UK and US to Singapore and China, authorities have reported increasing cases of domestic violence and demand for emergency shelter. This is rightfully a major concern regarding the situation in many developing countries, where there is often an unfortunate widespread societal acceptance of gender-based violence. But in our case, where are the shelters? How many are they? And who is funding them? Self-isolation for women in coercive or violent relationships mean being trapped, often without a means of accessing support or economical dependence, with a perpetrator who may become more abusive when there is no other outlet. Lockdowns also mean medical services and support to people affected by sexual and gender-based violence may be cut off or considered less important in healthcare structures which are overburdened by responding to COVID-19 cases instead. How lucky we have been in Africa that COVID-19 didn't ravage us. Lockdowns and lack of prioritization of sexual and gender-based violence response services may also mean that many women will face forced pregnancies. In turn, restricted access to abortion care facilities or pharmacies that provide medical abortions, if quarantine periods are extended, may lead to unsafe abortions and increased mortality among sexual and gender-based violence survivors. Another fear is that SGBV survivors may also face difficulties accessing contraception for HIV and STI prevention. Lack of timely treatment can put their health and life at risk. It can be stated that the increasing evidence of SGBV is the revelation of truth of what pertains in our society. Have we not done enough for too long that COVID-19 has exposed us? COVID-19 has only increased the numbers and exacerbates the issue. Additionally, according to the Domestic Violence Secretariat from March to May this year, during the early days of COVID-19, there were 4,000 reported cases of SGBV, rape, defilement, physical, and sexual abuse. But what is the impact of SGBV? If we've been talking about this for years, do we truly understand the impact of it, especially on society for women and girls? I'll take you through. While roughly 1/3 of females directly experience violence, its threat is ubiquitous. The threat of violence affects all girls, informing their choices and constraining their potential. Considering Goal 5 of the Sustainable Development Goals (SDGs), it suggests by its targets that eliminating SGBV is very critical in achieving such goals and invariably other goals. The specific targets for that include end all forms of discrimination against all women and girls everywhere, eliminate all forms of violence against women and girls in public and private spheres, including trafficking and sexual and other types of exploitation, eliminate all harmful practices such as child, early, forced marriage, and female genital mutilations, recognize and value unpaid care and domestic work through the provision of public services, ensure women's full and effective participation and equal opportunities for leadership at all levels of decision-making in political and economic and public life. To ensure also universal access to sexual and reproductive health and reproductive rights as agreed in accordance with the Program of Action of the ICPD and the Beijing Platform for Action and the outcome documents of their review conferences. Undertake reforms to give women equal rights to economic resources as well as access to ownership and control over land and other forms of property, financial services, inheritance, natural resources in accordance with national laws. Also, it's important to enhance the use of enabling technology, in particular ICT, adopt and strengthen sound policies and enforceable legislation. Now, we all do know about the story of enforcement of all the legislation, all the things we've ratified, agreed to as a nation in this country. SGBV has deprived many women the opportunity to achieve higher education due to various violations like forced marriage, child marriage, marriage by abduction, and rape. As of 2015, UNAIDS indicated that many of the new infections, that's HIV, which keeps going up, especially for the case of Ghana, were attributed to intimate partner violence and forced sex, a reflection that in many settings, there is no respect for body and consent, unfortunately. Girls who are forced into marriage are also at risk of experiencing intimate partner violence, and this continues the cycle of abuse because it is a she. This person in the relationship cannot make a decision of their own on birth control or their body by itself. But what has the PPAG been doing to ease the impact of SGBV on women and girls? It will be helpful to understand. Being in existence for 53 years and still counting, the Planned Parenthood Association of Ghana continues to champion sexual and reproductive health issues such as SGBV. Let's go through a few of the initiatives. They've continuously provided age-appropriate sexual and reproductive health information and services. There has been intensification of the fight against child marriage, sexual harassment, among others. There's been an increased reach of programs seeking to prevent and address gender-based violence, provision of psychosocial support services, including counseling services as well, which is very critical for the survival of victims. And also, the PPAG has been engaging women in designing solutions that are responsive to their needs, especially the victims and vulnerable groups who are at high risk of such violence. Also, there has been gender transformative programs targeted at boys, such as CARE's Young Men Initiative, that strive to shape traditional notions of what it means to be a man and how boys are expected to behave from childhood into adulthood. Working with boys from an early age is more likely to cultivate that gender equitable attitudes and a reduction in gender-based violence. If a boy growing up in a home does not see himself in the kitchen or sees his sister as the only person who would do household chores or is supposed to be the marriage material, how does he grow up himself to be the kind of husband that will support a woman who has a career in a family? So it's very important to involve boys, especially at a very young age, which PPAG has been doing through its initiative. Girls everywhere in the world are at risk of violence linked to their age, gender, age, or both. And some studies suggest that the majority of females who experience sexual violence do so for the first time in adolescence. And in this view, PPAG is developing adolescent-targeted and specific programs to address the peculiar needs of this category. I want to recommend a few things. that government, through the Ministry of Information, must look at regular public education on SGBV and all forms of violence against women with the use of social media, the traditional media, the information vans. The public should be educated on this, as well as the fines against people who continue to perpetrate these crimes. Government should also ensure that Domestic Victim Support Fund is well resourced each year. Because since 2007, when the DV law was passed, this fund had a plan to actually equip it with money that will go into helping pay those medical reports that are very critical to proving that a woman has been violated. We're looking at an amount of ranging between 200 cedis to as high as 800 cedis for some medical officers. And that fund was supposed to have catered to this specific needs, among others. And of course, the entire medical bills of a poor victim who has gone through so much trauma already. Our security agencies, especially the police, must live up to their mandate. The Ghana Police Service is mandated to maintain law and order and their functions according to the Police Service Act 1970, Act 350, and the Police Service Regulation 2012, CI 776, are to prevent and detect crime, to apprehend offenders, and to maintain public order and safety of persons and properties. We need a police service that is quick to respond to such issues, to train and handle victims of sexual and gender-based violence. And they must be sensitive. Sensitivity is important to the needs of these victims, because we do not want a scenario where the victim is re-traumatized in seeking justice. Our court systems must respond to the needs of society and ensure that such cases are given priority and the attention needed, so that in pursuing justice for that victim, they don't end up withdrawing the case or giving up along the line. Perpetrators who are found guilty and sentenced should be made public. We should have that list of sexual offenders so it can deter others from doing the same. Our health facilities should work on a modality with the National Health Insurance Authority and ensure that rape victims are not asked to pay huge amounts of money before they get that medical report. It deters a lot of rape victims from reporting. The Ministry of Education should also intensify the provision of counseling services for students at all levels so as to ensure that students who experience sexual and gender-based violence or signs can receive counseling and guidance on what to do. We must have a social protection system that protects victims. A complete system from the social welfare department right through to the police to the courts that protect the victims, including shelter. That social protection system is absent, and as far as it is absent, no matter how much organizations like PPAG and others do, the commitment from the state, which is absent in terms of giving us the structures for that social protection system, once that is absent, it makes the work even more difficult to protect victims. So we need a concrete social protection system as a country. Now, parents and guardians must do all they can also to ensure that their homes are safe now that school is still on break and when school resumes in January next year. Let's teach our children what to do, whom to report to if they see anything likely, and we must open up on issues of sex with our children. It starts from us before they go out there. If your home is not safe, your children will not be safe. Finally, I want to encourage PPAG and other CSOs working in this area to intensify the good work that you're already doing that has made so much impact in this fight, protecting victims of sexual and gender-based violence. Because of you, we are able to have safe homes, safe schools, a safe society, and we do have a safe world. Thank you all for listening. God bless us all.